healthcare is never far from the news, whether it be private healthcare costs, the costs of the NHI, when the NHI will come into play. And today we're going to talk about private healthcare costs, because something just, there was a presentation from Mediclinic this morning in Cape Town. And let me just read you the first paragraph of the press statement accompanying that presentation. It says, following recent reports and media coverage based on Dr. Anban Pillai's presentation at the Board of Healthcare Funders Conference, which we covered last week on Power Lunch, incidentally, Mediclinic Southern Africa, MCSA, wishes to challenge the analysis used to create the perception that is now in the public domain, and recommends that Dr. Pillay publicly retracts the conclusions he made concerning the relative comparison of South African private hospitals to OECD countries. The implication here is that South Africa is ridiculously overpriced. Now, this has been challenged by Mediclinic, as I say, and in the studio with me now is a health economist at Mediclinic. That's Okore Okorafor. Okore, thanks very much for popping in. You clearly are quite passionate about this, you and your organisation, that this analysis from Dr. Pillay is completely flawed.
Yes, we have looked at the data that Dr. Pillay presented. We looked at the graphs, and we see that there was an error, or actually a couple of errors in the methodology that informed the conclusions that Dr. Pillay makes. And we presented that this morning in a media conference, and we feel very strongly that he gave the wrong impression around our price levels, well, in general in South Africa, and that he should correct his methodology and hopefully let the public know what the true picture is.
Okay, so you felt it necessary to go public with this. What has been the reaction so far from Dr. Pillay? Has there been any reaction?
Well, we haven't had a reaction yet. Actually, the presentation to the media was done just about 30 or 1 hour ago, so we haven't had a chance yet to get a response from Dr. Pillay. Okay,
give us in your view, in Mediclinic's view, the flaws, the glaring flaws that you clearly set out here. I mean, a lot of it's quite technical, so if you could sort of keep it on a layman's basis, what has he got wrong?
Well, actually, what he tries to do is to use the OECD price levels for specific procedures and compare that to South African price levels and adjust the comparative pricing by purchasing power parity, which essentially is about the amount of money that you spend within your currency to acquire goods and services relative to the US dollar. And what we have done is to try to do the same analysis, and we found out that, first of all, what he did was to take an average of all the OECD dollar equivalent prices and then adjust them by purchasing power parity. That is the first error. Essentially, what you want to do is to adjust all the prices for the individual countries by their specific and unique purchasing power parities to arrive at a comparable figure for South Africa.
Is there a situation where there are certain procedures in South Africa that are on a par with their OECD peers, for example, and others that are more expensive? Is there a sort of a disparate range of costs? Are we good at one thing and good at another? I mean, that's one of the things that seems to come up in the report.
Well, what we've done is to look at the specific procedures that he used for his comparison, and we found out that for some of them, yes, we are cheaper, and for others, we are a little bit more expensive. Compared based on his analysis, we've basically used his methodology. And so we are not way out more expensive than other countries. We are actually very well and favorably comparable to them.
So it's interesting. I mean, this is not to be taken lightly. I mean, the Board of Healthcare Funders is an extremely important organisation, and for him to come out and say this, what was the conclusion? I mean, I understand what he's saying. I don't necessarily think that his methodology, from what you're saying, was correct. But what was he trying to say? That we are profiteering? The private healthcare system in South Africa is profiteering?
Well, first of all, he's from the Department of Health, and the message, I really don't know exactly what he's trying to portray. We have seen in the past year lots of things coming from the Department of Health that private hospitals are profiteering, and probably these went to show the extent to which we are profiteering, and this essentially is not correct. The analysis he did is not correct. So I'm not completely sure exactly what he wanted to achieve.
Have you had support from other private institutions in South Africa, health institutions? Or is this just done independently, Mediclinic?
This has been done independently by Mediclinic. Well, my colleagues were not there. Maybe I think a couple of them were there at the presentation. But immediately we saw that presentation, we looked at it, we picked up the flaw, and we thought, no, we can't let this go. So we decided to engage with the public.
Okore, how are you going to take it from here? What is going to be the result of this? Obviously, as you said, this was only an hour ago that you presented this to the press, and presumably Dr. Pillay will have heard about this. What is the next step? Because clearly you are poles apart from this analysis.
But we're hoping that he will respond to this, and we would like him to show us exactly how he arrived at his figures. I think that is, he needs to show us exactly how he got to those figures, and for us to understand what he's doing. Because from where we stand, this analysis was flawed.
Okay. Now, what about the general state of private healthcare in South Africa? How does it compare? Did that also come up in the analysis? We're talking about pure costs here, and some procedures that are alleged to be more expensive and some that are in line. But was there anything else in his analysis that talked about the level of service and the level of healthcare on a private basis in this country?
Well, we didn't focus on that, and we are an international company. We operate here in South Africa, we operate in Namibia, in Dubai, and also in Switzerland. And so we compare our own quality. We know that the quality of care that we deliver is at an international level. And so I don't know whether he did any further analysis on quality, but what really got our backs up was when he mentioned the pricing and said that we were as much as 5 times more expensive than OECD countries in purchasing power parity terms, and that is clearly untrue.
There has been in the past a phenomenon of so-called medical tourism, if you like, and I don't know if that is completely confined to cosmetic surgery, but if it's also people coming to South Africa from other countries, because of the quality of the healthcare here and also because of the price. Could you comment on that?
Well, there have been in the past lots of people coming to South Africa for healthcare interventions at our hospitals. It's about the quality of care that we deliver, especially within the African continent. But in terms of price, yes, we are comparable to other countries, and that is why people have been coming to South Africa. If we were 5 times higher in terms of purchasing power parity, no one will come to South Africa for healthcare intervention from other countries.
Yeah, exactly right. I think that actually says a lot. But anyway, we look forward to the response from Dr. Pillay, and I'm sure we'll be covering that on CNBC Africa quite soon. Okore, thank you very much for your time this morning. That's Okore Okorafor, who's a health economist at Mediclinic, commenting on Dr. Pillay.